Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about treating sinusitis symptoms naturally. Sinusitis is also known as rhinosinusitis because it results in inflammation of the mucous membranes that line the sinuses and the nasal mucosa. Sinusitis is defined as acute if it lasts for less than 4 weeks, and it is defined as chronic if it lasts for more than 12 weeks. Sinusitis is one of the most commonly reported chronic diseases. According to the Centers of Disease Control and Prevention, sinusitis impacts almost 30 million adults in the United States alone and 13% of the global population. A viral upper respiratory tract infection typically triggers sinusitis. Still, it may also be triggered by allergies, cigarette smoking, diabetes, regular swimming, diving, high-altitude climbing, and dental diseases and procedures. The sinusitis symptoms include a runny nose, a stuffy nose, tenderness, pain, and pressure all around the face, headaches, toothaches, a sore throat, and a reduced sense of smell. Many people with sinusitis also experience pain in the ears, they cough, they sometimes have bad breath and puffiness around the eyes, as well as facial swelling overall, and fever in an acute infection. There are plenty of acute sinusitis medications available, including steroid nasal sprays, antibiotics, decongestants, antihistamines, pain relievers, and systemic steroids. About 90% of patients in the United States are estimated to receive an antibiotic from their general practitioner. Yet often the condition resolves without any antibiotics. Antibiotics and other medications for sinusitis can sometimes cause worse side effects than the actual symptoms of the sinus infections. So some of these side effects may include indigestion, weight gain due to increased appetite, nausea, heart palpitations, and often constipation as well. Chronic sinusitis also may require a referral to an ear, nose, throat specialist for possible endoscopic sinus surgery. But surgery really should only be considered if complications of sinusitis are suspected. Now, a change in lifestyle and diet can help cure this situation without any complex surgery procedures, especially since some of the patients continue to be symptomatic, to have symptoms even after surgical therapy. These patients form a significant portion of daily clinical practice. Because of the side effects of sinusitis medication and surgery, more and more people prefer to explore natural, effective treatments for treating sinusitis symptoms. So here is how to remedy sinusitis symptoms naturally. First of all, diet. You want to stick to an anti-inflammatory diet. Dietary modifications offer an excellent means of reducing inflammation in people with sinusitis without any use of medication. Increasing the consumption of foods with anti-inflammatory properties such as fruits, vegetables, several nuts, and seeds can manipulate the diet for controlling inflammation. Fruits and vegetables and natural nuts and seeds are rich sources of nutrients and compounds with antioxidant and anti-allergic properties, as well as anti-inflammatory properties. Fruits should be consumed fresh and unsweetened. One should avoid fruit juices. The most potent anti-inflammatory fruits include strawberries, blueberries, basically all berries, cherries, and oranges. Vegetables should be consumed raw, steamed, sautéed, juiced, or baked. And the most potent anti-inflammatory vegetables include tomatoes, potatoes, foods from the broccoli family, and green leafy vegetables including spinach, kale, and collards. Nuts and seeds should be consumed raw in their natural form, and the most potent anti-inflammatory nuts and seeds include almonds, walnuts, pumpkin, flax, and chia seeds. Superfoods such as mancai, spirulina, chlorella, curcumin, barley grass, and wheatgrass have very potent anti-inflammatory properties, and these may be consumed fresh. But you You may also consume them in powder form or frozen. You can add them to shakes or your salads, or take a supplement. It's good to note, though, that you should avoid curcumin if you suffer from any liver disease or have a history of alcoholism. You also want to alter your consumption of meat, dairy, and other fats, which all increase inflammation. Saturated fats in particular, and trans fats. You want to aim to limit all animal products to no more than twice a week maximum. You also want to reduce foods that trigger allergies. Research shows a direct correlation between food allergy and chronic sinusitis. One study even found 81% of people with chronic sinusitis had a positive allergy test, even though only 11% of these people actually showed allergic symptoms. Now, other studies also report a very high prevalence of food allergy among people with nasal polyps, much higher than the control groups. Allergy testing followed by a food elimination diet is very effective as a treatment for especially unmanageable chronic sinusitis. There are immunological tests that an allergist may perform to determine if you have an allergic response to certain foods. Common food allergies and intolerances include wheat and dairy allergies, which you can avoid through an elimination diet supplemented with other foods of similar properties, such as gluten-free grains to replace wheat and legumes to replace dairy foods. You also want to consume foods that support a healthy microbiome by regulating the gut microbiome composition to prevent any imbalances. You reduce any ongoing inflammation and improve nutrient and macronutrient uptake. This is a very effective way to treat unmanageable chronic sinusitis. Many factors facilitate a healthy microbiome, including how many species of bacteria are present in your gut and whether your diet supports a healthy, varied gut microbiome, and also the time it takes for food to transit through your digestive system. So how do you facilitate these things, the healthy microbiome? One, you want to consume prebiotic foods. These foods are actually food not only for you, but also for your bacteria in your gut. The bacteria use these prebiotics to produce short-chain fatty acids, which modulate the inflammatory response and immune system. These short-chain fatty acids really reduce the risk of inflammatory diseases. Prebiotic-rich foods include vegetables, especially artichokes, garlic, leeks, potatoes, carrots, and asparagus. Also, fruits, highly prebiotic, are bananas, apples, oranges, and apricots. You also want to supplement your diet with probiotics to increase the number of bacterial species present in your gut. You want to supplement with a probiotic capsule on an empty stomach and aim for a capsule that has 100 billion bacteria at least, with 10 or more different strains. You also want to increase the fiber consumption in your diet to prevent constipation, which decreases the time of transit for food to transit through your digestive system. Short-chain fatty acids are produced by the healthy bacteria in the gut, and when the bacteria in the gut ferment the fiber in the colon, these short-chain fatty acids significantly reduce the transit time of foods in the colon. And the best types of fiber for the production of short-chain fatty acids in the colon include legumes, especially beans and lentils, and whole grains, such as whole grain wheat, barley, rye, and rice. These foods will help prevent the colonization of your gut with unhealthy bacteria and prevent the spread of inflammation throughout your body. Also, you want to consume a low-salicylate diet when you have aspirin-exacerbated sinusitis. High salicylate foods along with aspirin, will increase symptoms and worsening of this condition. A diet low in salicylates lowers your symptoms. And so let's get into the foods that are high in salicylates that you want to avoid. Beverages include beer, root beer, coffee, black tea, wine, rum, and liquors. And the foods rich in salicylates that you want to avoid include almonds, cloves, avocados, mayonnaise, peanuts, pickles, sweet potato, all kinds of vinegar, and many, many different types of spices, especially basil leaf, bay leaf, black pepper, chili, curry, coriander, nutmeg, and also vanilla. Also, alternative therapies can supplement dietary and medical treatment. They are very helpful. However, they should not be considered as sole therapies on their own. Dietary change should be done along with these alternative therapies. The first one is aromatherapy and essential oils. Steam opens the nasal passages and clears the mucus and relieves any sinus pressure. Steam inhalation is one of the most accessible home remedies. It just requires pouring boiled water into a large bowl and inhaling the steam. And to prevent the steam from escaping, you want to cover your head and the bowl, the sides of the bowl. You want to also add some soothing essential oils with the most positive effect that include frankincense, sandalwood, peppermint, eucalyptus, and tea tree oil to the water. Studies show that inhalation of specific aromatherapy oils really improve the symptoms of sinusitis. Also, you can try a nasal irrigation with salt water. Nasal irrigation clears the sinuses by moisturizing the nose and removing excess mucus. It's possible to make a saline solution at home using distilled water and non-iodized salt. You'll also need a saline rinse bottle or an ear bulb is to squeeze the solution into your nostrils. It's not very comfortable, but it is very effective. A very comprehensive study showed that nasal irrigation really does reduce the symptoms, especially as an alternative to medication for people with sinusitis. Also, you want to go for humidification with humidifiers. They hold a reservoir of cold or hot water. They blow air through a filter and they disperse moisture into the air, making breathing much more comfortable. You can use steam, warm water or cold water humidifiers. They have the same effect as the ones with hot water have the same effect as a hot shower. You can also use essential oils to the water in your humidifier for a much more therapeutic experience. Also, a recent study showed that sinusitis listed humidification as one of the top treatments for sinusitis patients. And to remove the symptoms, the moisture added to the air helps in breathing and promotes sinus health, because when the air is too dry, the nasal passages become aggravated and sinuses can become inflamed. So to summarize, changing one's diet is especially beneficial for treating chronic sinusitis and may prevent having to go through surgery and the side effects of medication. When diet therapy is coupled with alternative therapy, the treatment is very effective without any negative consequences. So I hope this could be of help, and I hope you liked this video. If you did, please give it a thumbs up. Please also subscribe to my channel if you like information like this, and also visit my website, The Gorilla Diet, for anything to help you move your health and wellness to a better place for you. Thank you very much for joining.